Hello, my name is Galicia, Llamas. For my post-surgical rehab project, I will be talking about the rehab for spondylodesis surgery. For my presentation, the first thing I'm going to talk about is what spondylodesis is, and then what the surgery looks like, the side effects to getting it done, and what the rehab looks like. I'd first like to talk about some of the anatomy to the spine. First, we have the disc annulus, which is the part surrounding the disc nucleus. The disc annulus is a thick outer layer that protects the nucleus, and the disc nucleus is a soft gel-like center that acts like a shock-absorbing spring. The disc nucleus also allows the vertebral bodies to roll over the nucleus. Next, we have the facet joint, which acts like a guide and limits movement to the spine. It also has cartilage to help them move smoothly. Next, we have the spinal or neural canal, which protects injury from the spinal cord, which contains spinal nerves. Those nerves connect to the brain to send signals. Lastly, we have the foramen, which is a hole that allows the spinal nerves to pass through, and those spinal nerves are what stimulate movement and feeling. What is spondylodesis surgery? Spondylodesis or spine fusion is a surgical procedure that fuses two or more vertebrae to form into a solid bone. This procedure helps relieve back pain as well as stabilizes the vertebrae. Some things that can cause you to get this procedure done is spondylodesis, which are unstable discs that allow the upper vertebral body to slide forward, as shown in the first picture. Next, we have scoliosis, which is sideways curvature of the spine, or kyphosis, which is also referred to hunchback, which occurs when there is forward rounding of the spine. Lastly, we have herniated disc, which occurs when the disc nucleus is pushed out into the spinal canal, which can cause impingement to the nerve and leave you with little to no feeling. What does spondylodesis surgery look like? For this surgery, you can either get an allograft or autograft. An allograft is getting someone else's bone graft, or an autograft is using your own, which is for this surgical procedure, it's mainly taken out from the iliac crest. For the surgery, first they make an incision on the back, which is 4 to 6 inches long. Posterior fixation is used to expand the intervertebral space, which is shown in the second picture above. Then the spinous process and lamina and facet joints are removed, as shown in the third picture. The spinal cord is then retracted to remove the infected intervertebral disc, which is done on both sides, and it is also shown in that third picture. Then a bone graft is inserted to replace the disc, and any extra bone graft is spread around to increase the fusion process, shown in that fourth picture. Then posterior fixation is also done by adding pedicle screws to stabilize the spine and prevent it from moving. This is shown in that fifth picture. Finally, the incision is closed with stitches, and drains can also be added for a few days post-operation. In that last picture, it shows what the fusion looks like after it is done. Are there any side effects to getting this procedure done? Some side effects from this procedure can be wound infections, blood clots, blood loss, or even nerve damage. What does post-surgery rehab for spondylodesis look like? After getting this procedure done, the three big restrictions to it are: you cannot bend or lift anything over 10 pounds, and you cannot twist. When getting out of surgery, you will have a physical therapist who will help regain mobility, and an occupational therapist who helps you do daily activities such as taking a shower or changing clothes. The first day after surgery will be the hardest. You may experience nausea or vomiting after getting up, which is why their main goal is to get you to start walking as far as you can to get back into that habit. and tents can be used to help relieve any pain. Depending on your surgeon, you will use a certain type of brace, and you may even use a walker to help you move. The first 6 weeks after surgery, the main goal is to regain comfort, and you want to do this by stretching nerves and muscles. And the key muscles you want to be working on are the quads and hamstrings. Some examples of stretching exercises you can do during the first 6 weeks are seated hamstring stretch, quad flexion stretch while laying down on your stomach, laying hamstring stretch, heel raises, ankle pumps, and hip flexor stretch. For the next 6 to 9 weeks, your main goal is to increase fitness and to strengthen your back structure. You can this will be done by doing dynamic exercises. Some examples of dynamic exercises that you can do are ball marching, which can also be done on your stomach or back, depending on how you are. Ball half crunch, bird dog, which is done to strengthen abdominal muscles. Single leg races, standing row, which brings the band close to you. Finally, we have abdominal contractions, which also help strengthen abdominal muscles. For weeks 9 to 12, our goal is to help the fusion setup and increase blood flow to help the healing process. This will be done by doing aerobic exercises. Some examples of aerobic exercises that can be done are swimming, speed walking, stationary bike, stair climber, yoga, or dance. Thank you for watching my post-surgical rehab presentation on spondylodesis surgery. If you have any questions, you can email me at 22alexag1125@ltusd.org.